Hello, and welcome to Perspectives. I'm your host, Rondrick Williamson. Today's topic is one that has the potential to affect every woman. It's breast cancer. Check this out. Every 13 minutes, a woman loses her life to breast cancer. That means that by the time this show is over, 2 women, maybe your grandmother, a mother, a sister, or a daughter, would have lost their battle with breast cancer. The purpose of this show is to give you hope. We're going to talk with a 5-year survivor when we come back. Her name is Shunder Clowers. She's going to share her story with us. Stay with us. You don't want to miss this show. We'll be right back. Welcome back to Perspectives. We're talking today with Shunder Clowers, who's a 5-year survivor of breast cancer. Shunder, so tell the viewers today, how did you discover you had breast cancer?
Well, I actually discovered as I was going for my annual with my gynecologist, my OBGYN, and normally what they do is when you turn 35 years and 6 months, they set up a pre-screening, a breast cancer pre-screening, which is like a mammogram. You just do it at 35 years and 6 months. And they sent me something in the mail, but I just like, nah, I am not 40. I don't need to do any kind of test like that. But when I got there, that was the first thing they asked me. Did you schedule your appointment? I said no, and they scheduled it immediately. I got my exam done, and he did a breast exam. There seemed to be no problems. I got my exam done. It was in 2005. It was in December. I got my exam done. They called me back, said, we see something a little cloudy. It's probably nothing. Let's go do it again. We did it again. They did what's called a needle core biopsy, and they aspirated some of the cells. They took a look at it, and at that time, in January, I got my results back. January 4th, something like that, that I had what was called ductal carcinoma in situ, meaning that the breast cancer was not invasive, which was a good thing, but I was precancerous. But it was something dangerous to be at that time because my potentials were higher. I was still possible to have children. I could get pregnant at any time, and the hormones is what was going to feed it to make it invasive and more dangerous. And so after that, I had to go through the process of discovering what I was going to do about this.
So what was your immediate response when you found out that the diagnosis was breast cancer?
I'm going to die. I'm going to die. And I was devastated. I had only been married a short period of time. It was just a little over 2 years. And I was devastated. You know, the potential for children and everything flew through my mind because I didn't have children at that time. And so it just affected my whole world. And there's no way to describe the devastation of finding out that something, because your first mind isn't that, oh, we can fight this, this is curable. My first instinct was, I'm not going to survive this. So it wasn't a good day.
And there were no warning signs, or you were otherwise healthy, so it was pretty much a shock to you, I would imagine.
Completely healthy. I had no problems, never been to the hospital, never been to the doctor really. So it was a shock. And it wasn't just a shock to me. My doctor at that time, he was kind of, you know, shocked also because we weren't expecting any kind of negative diagnosis from something that was just a pre-screening.
So what happened after that point, from diagnosis to, what was the next step actually?
The next step was to see a surgeon, and the surgeon then discussed what exactly was going on, because the doctor my OBGYN didn't tell me what kind of breast cancer I had. He just said I had breast cancer. It was the general surgeon who broke it down and began to discuss possibilities of what I must do. At that time, I was either to remove both of my breasts or do what's called a lumpectomy, which was move a portion of it. But he didn't let me go through that without being more informed. So I went to see an oncologist, and she discussed my options with me and what the possibilities of the things that I would have to do and what I would possibly have to go through. At the time, I chose a more conservative way, and which was the lumpectomy. But that didn't work out for me. Later on, when the pathology report came back, it said that there were too many cells. And so the next option was to remove my breast.
So the first option, the lumpectomy, did the doctors say that they thought this was something that was going to lead to a successful cure rate or
no,
a successful outcome?
I'm sorry, no, actually they preferred me to have the bilateral mastectomies. And that was just something I didn't want to do. I mean, I was just married, and as a woman, that's a part of you.
Right.
You know, if you ever had any complaints, if I ever had any complaints about my breast at that time, they all went out of the window when they said we're taking both of them.
Right.
So no, I chose the less conservative because I didn't want to go through that process. Right. So when it spun around that I would have to go through that, it wasn't a good thing for me.
Now, when the show contacted you about possibly doing this, this interview with me, one comment you said was that breast cancer it lessens your vanity. What did you mean by that? Does it?
Well, what I meant by that is that at some point, for one thing, is that you're exposed so much. I've never seen as many doctors as I had seen at that time. At that time, it was like every week, every 2 weeks, I was seeing another doctor. So that lessened my vanity. But the very fact that, you know, when I was vain, because I happened to be a very chesty woman, and I was always very self-conscious. At that point, when they say it's gone, you're not getting these back, we have to give you some new ones, it was less about that anymore. It was less about the vanity of it. Right. And then having to go through the plastic surgeries and all the stuff that you have to endure. To me, it's like it wasn't even, I wish I would never have to go through it again, but I would do it the same way. Right.
So you actually had the double mastectomies and you had implants, am I correct?
Right.
Tell us about that.
Well, one of the options that we had was that you could get immediate implants, and what they did was kind of prep you by putting in expanders, which held the place until you can get your implants in. And I chose that route because I didn't think I could bear waking up from a surgery and having nothing. Right. And I didn't think that I could conceive of going from one huge size to a much, much, much smaller size. Right. That was more than I could fathom at that time.
But not from just going from something to nothing.
Was not going to happen.
Right. So the double mastectomies, and then was there chemotherapy, radiation therapy following, or how did that play?
At that time, no. The treatment of choice for prevention was the bilateral mastectomies, and that was all we would have to do. I would have no chemo, no radiation treatment, nothing of that nature.
Did that work?
It did and it didn't, because last year I found out. Well, in '09 I had my regular exams, and that's why it's really important after breast cancer that you see your doctor the way you're supposed to, because they catch things very early. And somehow there was a raised area on my breast, and my plastic surgeon found it. And he said, "Oh, we're just gonna check it, see what it's all about, see what's going on." He checked the area, cut it out, biopsied it, and it had cancer. Okay. So it wasn't big. They thought he got it, but he referred me back to my general surgeon. My general surgeon said, "Nope, we're going back in there. We're going to check again, and we're going to do a test of your first and second sentinels to make sure it's not in your lymphatic system." They were not in my lymph nodes. They checked them. They weren't in my lymph nodes. They cut deeper. That was clear of cancer. The lymph nodes were clear of cancer. But as he was checking me and filling up under my implants, he found a little dark something up under that implant. Pulled that out, biopsied it. That was cancer.
Now, how long was that after the double mastectomies and the implants that they find that?
that was about, the first occurrence was in my surgeries for the bilateral mastectomies was 2006, and this was 2009.
Okay.
So about 3 years.
Okay. So that happened, then they biopsied, it came back positive, and then what was the next step?
The next step, I had to go, after they removed it and looked everything clear, they were afraid to do anything else. They didn't want me to have to go without chemo and radiation, so I had to go through the chemo this time.
Okay. So how did breast cancer actually change your life? I know that, having, my producers talk with you about there's some things that you have done after the fact that you always wanted to do. Tell us a little bit about that.
Well, I think what breast cancer does is it gives you, especially after you survive all of the horrors of what you've gone through and thinking that it will be, am I going to survive? Once you survive, it just opens your mind to do more things, to explore other things. And one of the things that I did was I took a ballet class because I love liturgical dance. I think it's the most beautiful expression, and because I'm dramatic and expressive, I thought, and that always makes me cry. Visual things make me cry. So I thought it would be a good way for me to express myself and my worship to my God that got me through all this. So that was one of the things I did. I took a ballet class so that I could kind of work my way into liturgical dance, and I did a workshop. I found one, drove to North Carolina, didn't know where I was going, why I was going, what denomination, I didn't know anything. And I just did it because I wanted to do something different. Right.
Do you think that after going through an event like breast cancer or any tragic or diagnosis that we would perceive to be tragic, that it makes you think differently and makes you go back and say, listen, now I have an opportunity to do all the things that I thought I wanted to do, and now I'm going to do that now because I may not have that opportunity again. Right.
It does make you think differently about things. It does make you more adventurous because you feel like, God, you pulled me through this. What else would you want me to do that may be beyond what I could have thought in the beginning? Because sometimes you box yourself in, depending on who you are. I could box myself in because I got stuck in a rut of doing and not doing what I've never done before. And it does pull you out some. And then it makes you, if you embrace it or embrace the trial, if you can call it embracing, if you embrace the trial and the lessons that you learn through it, it makes the little petty stuff not important. You know, the back and forth that people can do and bickering and pulling for this and pulling for that, it becomes less important. You know, other things become more important.
You know, listening to you speak, it seems to me that even though you going through the process was not easy, but that you really benefited from going through the process. So you actually learned something out of that whole, and a lot of times we go through things that we don't understand, that put us in an awkward situation, but when we come out of it, we see the benefit of having had that experience. Can you comment on that a little bit?
Absolutely. I think that you go through the process and you think at the time, why am I going through this when there are people who do and live so much worse than I have? You know, I've always, I've grown up in the church and I've grown up loving God, and I grew up doing all I can to do what was right. And I read my Bible and I tried to live the way God would want me to live, but my circumstances didn't match what I was going through, or how I lived. And I'm like, God, why would you allow me to go through it? But I tell anybody that it is the best, worst thing that I could have ever gone through. I don't ever want to go through it again.
Of course.
But it is the best thing that I could have gone through, because the things that I've learned and the way that I've grown and the relationship that I've developed with my Savior is unlike anything that I could have had before. And we think that we learned lessons, that you don't have to take me through this for me to learn this lesson. But sometimes God has to take you through these things so that you do learn the lessons. And if you embrace it, you grow.
Right. You know, one quote I often reflect back on is that someone told me once, is that pain is the gift that no one wants.
True.
But we can't learn without pain.
Right.
And it's so true, it's so important.
Right.
I know that you had a very big support network. I understand that when you were, I guess, about to undergo chemo, your mother was instrumental in helping you cut your hair.
Well, actually, when you go through chemo, like the first 2 or 3 cycles, at least 2 cycles, you don't really experience that much hair loss. But when it got close to my second, I started losing my hair. And it was I kept saying, Mom, my hair is coming out. And she's like, no, it might be just shedding.
You knew it was coming out.
A lot of hair. This is a lot of hair in this brush, and I need to talk to you. So she came up, and she cut my hair. She cut it for me.
So how important was that for you? And I guess a follow-up question to that is it important to have a good support network while you're going through, or did you find yourself wanting to just isolate yourself from individuals altogether?
For me, some of both. Everybody's not the same. Every person approaches their situation different. And for me, I was a little of both. The people, my friends that were closest to me knew. My family, they all knew. But I didn't tell a whole lot of people because the way that I had decided to handle my breast cancer was to trust God for the healing, trust God for my doctors, trust God to give my doctors wisdom, trust God that I was going to survive this and that I wasn't going to die from this. And I personally didn't want to hear the horror stories of other people.
Right.
Because when you start sharing that, oh, I'm going through this, then they bring up about their aunt that they lost, or their cousin that they lost, or their sister that they lost.
It's not the time to hear that.
It's not the time to hear that when you're already trying not to lose it because you feel like you're about to die.
Right.
And I think people they don't remember that that's an issue for that person. They feel like they're on the brink of death. And for you to remind them of someone else's death, it makes things worse for them. So I just chose to protect myself. I think it was God inspired. God was like, you know, don't tell a whole lot of people. You know, you just smile and go through this. Don't tell a whole lot of people, the people closest to you. And I had a wonderful support system that, you know, talked me through it. And, you know, they didn't make me feel like, and then people feel sorry for you. Oh, I can't believe I can't believe she's got breast cancer.
And you don't want to hear all of that,
you know, I'm already trying to keep from feeling sorry. Half the time I was feeling sorry for myself.
Right. So you didn't need,
and I didn't need extra.
A pity party.
Right. I needed people to just see me for who I was. So I went through a lot of it without a whole lot of people knowing.
So what would you recommend to someone who has just recently been diagnosed with breast cancer? If you had some words of wisdom to give that young lady who may be watching us on today, that will help them actually get through the journey a little better?
If you don't know God, find out who He is. For one, I think my relationship with God and reading His Word and meditating on His Word helped me through a lot of it. And believing that you can survive this, but most importantly to know, don't give up. Don't just lie down and let things happen. Doctors have wisdom, listen to them, listen to what they have to tell you, but know that your doctors are there to help you make informed decisions. Some of the decisions that you make may not line up with what the doctor wants you to do. Like I made the decision the second time around, they really wanted me to be on a medicine for certain cancer survivors. They want you to be on a medication that may make you sterile. And I haven't had any children. There's nothing wrong with me any other way.
Right.
So in my mind, until I have a child, I'm not taking it.
Right.
But that was an informed decision. It wasn't a decision that I just said no. I listened to everybody. I listened to what everyone had to say first. And that's important. You have to listen and be willing and be open to say, I'm going to do all that I can, but there's some things I have to feel good about doing.
Now, speaking of the medication, it made me think of another question actually. Were there any things that you changed after the situation? Were there any lifestyle changes, any changes in your diet, changes exercising more?
I would love to tell you that I did all these changes and I don't eat this, that, and the other. I'm working on it.
You're working on it.
Yeah,
okay.
I'm working on it. I'm not gonna lie and say that now I don't eat. I try to eat more fiber and do some of the things that they told me, but I can't.
You can't say that you really.
Honestly, no.
Wow. Listen, those are some very encouraging words. I'm sure that somebody viewing today was inspired by your testimony and your overall experience. We'd like to thank you for being a part of the show on today. Listen, viewers, when we come back, we're going to talk with Dr. Cheryl Jones, who's an oncologist with Georgia Cancer Specialists, who's going to give us some great information on breast cancer. Welcome back to the show.
Thank you.
It's wonderful
Good
to
to
have
see
you.
you.
Listen, tell our viewers, how important is it to have mammograms done, and how frequently should they have mammograms performed?
Right. Studies have shown that for women, they should begin to have mammograms at age 40 and have one every year. For women younger than 40, it's based upon their family history and other risk factors that they might have. Mammograms is just one part of the screening to detect breast cancer at the earliest stages. It's important that women continue to see their physicians at least annually, because mammograms can miss 10 to 15% of breast cancer, so they need that good physical examination. And it's important for women to continue monthly self-breast examinations.
I was just going to ask about that.
That's been a little controversial lately because of the information that monthly self-breast examinations do not always improve overall survival. However, they do allow women to detect a change in their breast that may take them to a physician earlier for earlier diagnoses and help their treatment and path through breast cancer be much easier. And it's cost effective.
So do you think that breast cancer can be, the longevity or the diagnosis can be diagnosed earlier if women were to do the monthly self-breast exams and have mammograms on a regular basis when they're at age 40?
Yes, with mammograms we can detect breast cancers long before. I'm talking years before they can be identified by just routine physical findings. Now, and it's important, the earlier we diagnose, the more likely we are to cure women with their breast cancer, and their treatments are less severe or aggressive.
So now, women, what are some of the things that the women who should be really concerned about developing breast cancer? Would it be, I guess I'm trying to ask, what are the risk factors?
Right.
I know family history is a big one, but are there any other risk factors that are important?
Right, family history I think is one that most people think about. And about 25 to 30% of women will have a family history of breast cancer, which means 70 to 75% will have no family history at all. So that is a reason that being simply female is the biggest risk factor. Now, your incidence of breast cancer does increase with age, which is why we start mammograms at age 40. Interesting, there are some racial differences in breast cancer. And Afro-American women tend to develop breast cancer at a younger and often more aggressive form of breast cancer than the average Caucasian woman.
Why is that? Is there
There's a lot of interest and study in that, and we don't know the exact reason at this point. Certainly genetics is a big component of it, and lifestyle. But breast cancer is no longer determined as just one disease. It's not one treatment fits everybody. We're beginning to understand the features of breast cancer and the different types, and today there felt to be at least 5 different types of breast cancer.
Do you find that, like in Ms. Clowers' case, when women have to have a double mastectomy, are there self-esteem issues? Are there self-issues that are brought forth that weren't there before? Is morale decreased, or what type things do you see occur after this procedure?
Well, after the mastectomy, you know, there are opportunities to perform reconstruction, and a lot of people just don't know that you've had a mastectomy when you meet them on the street.
Of course.
Yeah. However, I think the hair loss is a bigger thing for women.
Yeah, that's a big key.
And I'm told constantly when people saying, you know, it's just my hair. It's not my life. I don't care. Well, that's true, except when you're having a good day and you're on chemotherapy, and the chemotherapy has somehow gotten the back of your mind. It's that reflection in the mirror, in the microwave, in a window, where all of a sudden you realize, oh yeah, wait a minute, that's that kind of slap in the face and wake up call. So sometimes the self-esteem issues are the little issues. Fortunately, there's tremendous help for women through support groups like Look Good, Feel Better from the Cancer Society and local support groups that really help women to overcome any self-esteem.
Well, I do want to ask this question. What things can cause cancer to return? I know in Ms. Clowers' case, she thought she was cancer-free even after her double mastectomy and her implants, and then there was another spot that was found. Right.
Now, in her instance, if there can be a fortunate incident, that she had a local recurrence and it hadn't spread elsewhere to her in her body. So the lungs and liver and bones were not involved. And so that's very fortunate. But breast cancer spreads, we know, both through the lymphatics and through the bloodstream. At this time, we're learning some of the factors that place women at increased risk to develop. But we don't know all of them yet. We're beginning to understand more about the immune system, more about some insulin growth factors, which is why diet, exercise, and maintaining a healthy weight is actually very important to reduce the risk of recurrence.
Right. So if you could give some final words to some breast cancer patients out there, or a young lady who may be going through breast cancer treatments right now, what would it be?
Well, I think that in listening to Ms. Clowers, you know, it was very obvious that you need to find your support system. You need to find your strength. I see breast cancer as somebody who treats it every day as something that's empowering for women, whether it's to find your spiritual center, whether it's to realize that you've put yourself on the back burner because you're taking care of your husband and kids and your job and everyone else but you, to use this as something for empowerment, to improve your lifestyle in all types of ways, not just your medical health, your spiritual health, the way you approach everybody, and to keep that really positive attitude.
I think that's the take-home message with any situation that you may be going through that is something that you're not accustomed to, is to keep a positive attitude. I think that's just works across the board. Dr. Jones, we thank you for coming back to see us on today. Listen, I told you last time you're going to be our resident oncologist. It's true, so we're going to call on you sometime again in the future. Thank you so much for the information.
Thank you.
Listen, we're glad you've been watching with us on today, learning a little bit about breast cancer. For more information about breast cancer, please visit Komen.org or visit breastcancer.org. Make sure if you're on Facebook or if you're on Twitter, follow my show, or you can just go to my website, perspectivestv.com. You've been watching Perspectives. I'm Rondrick Williamson. You've been informed and inspired. We'll see you next week.